Hello all. I thought I would jump in because Emma has very kindly said she's happy to do her treatment live today. So we are going to do a wow fusion. We've got to the point of the year where the risk of having lots of sun exposure has reduced. In fact, it's absolutely tipping it down at the moment. Most of the people have got the few people that managed to get away this summer are back and their skin is starting to settle, but it's starting to throw up a few problems. People's skin's feeling a bit dry, pigmentation flare-ups are occurring, and so it's really a really good time of year between now and Christmas to start adding those treatments back in. I apologise for my noisy dogs. It's just something I have to manage, I'm afraid. So we're going to do a really lovely wow fusion treatment, which is a microneedling device, and with a very personalised product. So for mesotherapy. So I've chosen a combination I'm going to show you today. The base for all of our wow fusion treatments is hyaluronic acid. So this is a hyaluronic acid serum, and that makes up half of the base of the mix that goes into the mesotherapy. And then we use a combination of the vitamin complex. So this is a vitamin complex. I'm sorry, I think there might be a delivery or something, which is why the dogs are going mad. I'm really sorry. So the vitamin complex is really, really brilliant for general skin health, for keeping the skin sort of fresh and hydrated, and getting it functioning better, which is always my priority for you guys. And then the age complex. Now, Emma's skin isn't very aged, but we want to keep it nice. And so I've done equal amounts of the vitamin complex and the anti-age treatment. The other one that can be added, which I haven't needed to add for Emma, is the white. So if you have pigment, this is a really powerful way of starting to get on top of that. It really gets into pigmentation. I tend to spot treat before I do a full treatment. So we would use the white on its own and actually spot treat into the pigmentation. But also I haven't needed to use that with Emma. There is one other wow fusion product. It's for hair restoration. That's a different thing entirely. So we'll do one of those over the next few weeks. We've now launched the hair restoration package, and it is on the website if anybody wants to have a look at that. So I'm going to ignore the dog. So this is actually upside down now. This is the wow fusion device. The mesotherapy complex is in there, and I don't know if you can see how close do I need to get so you can see it. Is it going to focus on that? I don't know if you're in the bottom, you can see a little knob, little sort of knobbly bit there. That is, as that presses onto the skin, it releases the mesotherapy, and there are a series of very tiny, very fine, gold-plated needles, which go into the skin, and it deposits that mesotherapy into the surface of the skin. This is a 0.6 millimeter needle length on this device. There is a 1 millimeter needle as well. Now I'm hoping this is going to flow for me. I have used a very small layer of a local anaesthetic cream just to take the edge off. Most people cope with this very well, but I kind of figured that as I've got it, I may as well use it. So Emma's skin is already prepped. It's had a layer, like I said, it's been cleansed, it's been prepped to make sure there's no oils, no greases, no dirt left on the skin, and then a layer of local anaesthetic, which has had a chance to work. So as this goes into the skin, it should release, which it is, a small amount through the needles. The needles have a groove in them, which helps deposit that product directly into the epidermis. All of the areas of the skin that I'm concerned with, largely speaking, are in or just below the epidermis, so the products really get to where I need them to be. The treatable, sort of, for example, treatable pigmentation is in the epidermis. Pigment sort of travels up through the layers of the skin, and we treat it when it gets to the top. You can do other things for all of the conditions we've talked about, so for aging, rosacea, acne. I wouldn't use wow fusion for active acne, but it's very, very good for the skin health, for treating scarring, This is great for rosacea. You can add Botox to it to get a really brilliant result for oily skin, open pores, and to add for hair restoration. Brilliant for all of those things. And if you've got lots of broken veins and redness on the skin, the addition of Botox can actually be quite useful for that as well. So not used for muscle freezing. Because the treatment itself isn't very long. I've nearly done all of the forehead. It's the prep of this that takes the time. So Emma has we're aiming for 3 to 4 a year with the occasional peel in between. I think you've got some home products, including have you still got enzymatic peel at home as well? So Emma's got a home peel as well. So she has quite a good home skin routine. And the treatments in between, this is a bit like going to the gym regularly and having a sort of personal trainer to give you a boost and to make sure you're on the right track and push you forward a little bit. So that's the treatments. Your home care is your gym, or generally exercising every day. That's the equivalent of your home care. And then the equivalent of your PT sessions or going to a class and getting a bit more of a workout, that's your treatments in the clinic. So there's lots you can do at home, and what you do at home is really, really crucial. But the two together is where you're going to get the best results. And if you're going to do one or the other, do home care. I don't really recommend doing in-clinic treatments without doing anything at home. So Wow Fusion is starting to become my go-to treatment as well. Turn your head a little bit further for me. When I first do a skin consultation with somebody, particularly if we're just looking at general anti-aging and rosacea, quite often this and a combination of Wow and chemical peels would be where I started, particularly with top-ups of LED and those kind of things. What is my dog barking at? So it's blooming typical that she starts to go off right as we're in here. So there we go. So if you can see this, Emma had anaesthetic on for 5 minutes probably. Mm-hmm. How does that feel?
I can hardly feel anything. I just feel a pressure.
Okay.
From me pushing down, but there's no sharpness or anything.
And I think the last one that we did, actually she had, I don't think we used anaesthetic. I don't always for 0.6 mil needling. For 1 mil I would use anaesthetic. If I've got it to hand, I tend to pop a bit on. I'm really sorry about my dogs. So, okay. But yeah, so it's quite bearable, even without the anaesthetic, but it just makes it that much more comfortable. If you're feeling a bit hormonal, if you've got a low pain threshold, then I would definitely add on the anaesthetic. And I put it on while I'm getting everything ready, to be fair. Where's my husband when you need him to silence the nuts? So as you can see, the whole treatment doesn't take very long. It's maybe 15 minutes from start to finish. And then what will happen is there will be a certain amount of redness for up to an hour, although Emma doesn't respond too dramatically, so she's not going to go out of here looking, like I've sort of thrown something caustic in her face. But usually within about an hour things have settled down. I ask you to be very gentle with your skin for the rest of the day, and I will advise on products. Sometimes I'll give you some products to use for a few days as well. The most important thing for the rest of the day is the SPF that I'm going to use. If I saw any sort of active acne, any active breakouts or spots, I wouldn't needle directly over those, because what can happen is you can pick up the bacteria in that spot and transfer it across to fresh skin and end up with a bigger breakout than you started. So, which is why I would never treat somebody with active acne. I would always wait to maybe treat the breakout first, put them under LED and wait until that has all settled before I would treat them, and hopefully get sort of more regular acne properly under control before I treated with any sort of needling device. Now, there's a couple of places that can be a little sharper, and the lovely Pam Cushing, who was my trainer a few years ago, basically said to me, tell them to put big girl pants on for this bit, but hopefully because she's had that local anaesthetic, it won't be too bad. So those areas are around the lips, sort of top lip, nose and around the eyes. But we can do, because of the way this works, you can actually get quite close to a lot of the eye area, because you can just gently move the skin back, so you can cover areas that really need treating. I mean, to be fair, Emma's not got a lot in the way of, and in fact, you've not even had any toxin around there, have you? So she's pretty good. She's not got any crow's feet. She's too young for that yet. So we're going to do around the bottom lip. Is that okay?
Yeah.
I don't actually needle onto the lips themselves, but up as close as we can get to help avoid, well, either treat or avoid what are called smoker's lines. Even if you're not a smoker, they're still called smoker's lines, I'm afraid. So this is the bit that can be a bit sharp, so big girl pants time. Don't need to rush this treatment. We want those gorgeous ingredients to travel down with each stamp. Looks like we might have a little bubble. Okay. And then we're going to go across the nose. Again, can be a bit ouchy, very sensitive place. I did one of these this morning. We used a 1mm needle and it had the addition of the Botox in it. She's got quite a few broken veins. Rosacea, not Emma here, the lady I treated this morning. And we've made a lot of progress on those broken veins and the redness that she's got. And this would have been another nudge forwards. Again, this bit can be a bit sharp. Emma's got tattooed eyebrows, so I'm going to avoid those. I don't want to pick up any of that ink and move it around. But what this means is I actually get quite a lot of that eye area by pulling back gently without overstretching. So it treats quite a lot. So you don't treat onto any of the soft areas. I wouldn't stamp it onto her eyeball. And then can I get you to look right up for me, Emma? That's brilliant. So again, we pull down and treat along the bone line of the eye socket. So again, you can get quite a lot of that. Oh, is that making your eye water? Yeah. You're all right. Give you a tissue. I thought that was my device leaking there. There you go. Was that a bit sharp? You right?
I think it was actually just opening my eyes. I think it was the lip more.
Okay, sorry.
Than that.
Okay, close your eyes again. You can do it with your eyes closed this time if you like. So again, like I said, I'm not going directly over her tattooed brows. Very neat they are as well. Okay, and then I'm just going to do that so you don't have to open your eye. It made you water last time. Okay, so that's the whole facial area covered. How long does that take? I can't see how long we've been live for on this one. But we've got a tiny little bit left in the device. So what I tend to do is go over the areas that need it most. So to be fair, Emma's skin is really, really good. But I'm just going to put the places that I know are going to develop any lines and sort of show signs of ageing first. So we're going to treat across the forehead. So Wow Fusion is a really, really good treatment. The ideal protocol for Wow Fusion is the first 3 would be 2 weeks apart. If we're using toxin in it, the Botox, you do that the first one and then every 3 months. And then you do them monthly. So you don't have to do it. That depends. If you're already having treatments, I can then just drop them into an existing protocol. And I quite often alternate monthly between Wow Fusion and chemical peels or Geneo, because they all have slightly different actions on the skin and they all have different things to bring to the party, so to speak. But I have some clients who just have Wow Fusion because they're such a nice treatment and they're clinically very active. It gives very, very good results, and people love how it makes their skin feel. There's very little in the way of downtime. Turn your head towards the camera, Emma. If you can see this, there's virtually nothing in the way of redness. By the time she leaves here in a minute, her skin's going to look glowing and lovely, but without looking sort of raw and, like I've done something terrible to her. Skin pen microneedling is a slightly different beast. It's a little bit more aggressive. It's more for much more sort of aged skins. I use it more for sort of acne scarring, chickenpox scarring, and other scars and stretch marks. Whereas this is more for general skin health and most cases of anti-aging. Now the last little drips, we don't want to waste any of this. The last drips of the product, because we've already got those tiny little microchannels in the skin, by applying the rest of the product directly to the skin, there's only a few little drips left, the skin will suck all that in and it will draw all that into the skin. Emma, it shouldn't make Emma's skin feel horrible. Did you find it felt anything unpleasant afterwards last time?
No, not at all.
What did you notice?
My skin was a lot plumper. It felt amazing. It was so soft and rejuvenated.
Okay, so I said the reason we're doing this for Emma is because it's to slow down aging. You're 30.
37.
So Emma's 37, of course, because you're almost 10 years younger than me, which is depressing. So Emma's almost 37, so she hasn't got aged skin yet. But by having not too frequent, regular treatments, she can slow down that aging. She can make sure her skin doesn't start to lose collagen. It keeps the hydration. She's protecting it from UV rays all the time. And so if 3 or 4 times a year we did a really nice, robust clinical treatment like this, it's going to pay back massively as she does get older and the skin starts to sort of, succumb to time. But she's doing all the right things. She's counteracting a lot of the things that cause skin problems by starting now. Prevention is always better than cure, but that's not to say that we can't do something if you haven't done anything before. They said one of my favourite sayings is the best time to plant a tree is 30 years ago, the next best time is today. Because I can't change if you haven't done anything with your skin before, if you haven't looked after it, you haven't worn sunscreen, but we can start now to get the best out of your skin for you. So that you can see that's all finished. The last of that product's all soaking in because the body is now drawing that through those little tiny little holes that we've made in the skin. Really important now that Emma looks after her skin for the rest of today. And we're going to put some sunscreen on. The sunscreen I'm using for this is designed by the same company that made the Wow, and it's called Synergy 6. I do have this on the shelf as well for day-to-day use. It's a lovely one to use, but it's safe to put on after a 0.6mm needling. I wouldn't use this after skin pen, for example, but for this it's perfectly safe to use. And it's really important that we help Emma protect her skin for the rest of the day. Tomorrow she can start using some gentle products. We use Sensor Calm, Recovery Balm and sunscreen, generally speaking, after treatments. And lots of water on the same day. Emma doesn't drink alcohol, but I would say no alcohol today. Trying to keep your caffeine intake low, anything that dehydrates the skin. So this hasn't taken us very long. The whole thing start to finish is about 20 minutes, like I say. It's a 45-minute appointment because a lot of it's me faffing around with drawing up products and that kind of thing. But generally speaking, it's a 45-minute treatment. So that's all done. That's sunscreen. That will all soak in. I am saying to people, if you can avoid having to wear a face mask at the minute as well, it's not ideal if you've just had a treatment either. So I sort of make sure people book this around times where they know they're not going to have to go somewhere where they know they're going to be asked to wear a face covering. So that's it. That's all done. How was that?
Lovely.
Not too... His eyes are watering.
Now,
not painful?
No, not at all.
Brilliant. So hopefully that was useful. If anybody's got any questions on that, then feel free to ping me a message. You can book online through my website, Sally Wagstaff Aesthetics, which is sallywagstaff.co.uk. And other than that, you can always call us as well. The number's on the website, it's on the Facebook page. Hope that was interesting, and we'll do a peel next time. And I am going to go live doing hair restoration as well, because the Wow Fusion is an amazing treatment for that. So hopefully that was useful. Nice to be back. I'll see you soon. Bye.